research looks into how people think, how they feel and what they do about vaccination. And I look at the acceptance of vaccination among parents, among adults who are considering vaccination for themselves, healthcare workers, pregnant women and so forth. And I also look at how we can improve the way we communicate about vaccination so that we can get high uptake of vaccines and high acceptance of vaccination. I'm very pleased to now be part of a comprehensive program of research that's called SARA, which is Strategies and Resources to Assist Hesitant Parents with Vaccination, and that's been funded by the federal government, and it brings together many years of knowledge that we've acquired about this vaccine hesitancy problem, and some ideas we have about how best to address that through tailoring and targeting and engaged communication between parents and health professionals. So one of the highlights for me has been the opportunity to advise the US government on matters that relate to acceptance of vaccines, and I had the privilege of being asked to address the President's Cancer Panel on improving uptake and acceptance of the HPV vaccine. And I've also had the opportunity to advise the US National Vaccine Committee and the National Institutes of Health. And I guess that's a result of having that opportunity and privilege to study this one area for 18 years and collect together lots of knowledge so that you become a bit of a specialist in that area. And for me, it's been incredibly exciting to be able to see research that's often sort of buried behind paywalls or gathering dust on library shelves, shared with people who can make a difference, have the capacity to change programs and improve programs so that we can see the research become action. The challenge is having the perseverance and the opportunity and the funding to stay in the one area and build that knowledge, build the connections and the relationships so that you can become a conduit between the research and the policymakers and the practitioners. The other challenge has been working in a very contentious topic. People feel very strongly about vaccination, and it's understandable. It's about protecting our children, our adults, our communities from potentially serious diseases. And because people can feel very emotionally about this topic, they can react quite strongly to different ideas and views. And so when you're engaging with the media, it's inevitable that people will react strongly to some of your ideas and views, and that is definitely a challenge.